Hi guys, this is Dr. Ed here with Pamela Schwartz at the Schwartz Wellness Center in Redlands, California, somewhere between Palm Springs and LA. This is part two. Please watch the first part, which was her miracle story of how she cured for herself ulcerative colitis, something that that we can't normally say, but she's a perfect testament, to um, how you can do something that just doesn't make sense in medicine. So, I really was curious about something called ozone. A lot of my, I've heard about it. I get every practitioner who's using it, they get super excited about it. They like, oh my God, this is amazing. So, what is ozone therapy? And perhaps tell me an experience that you had with it.
Okay. Well, ozone, I like to describe ozone like super oxygen is kind of how, is an easy way to understand it. We all know oxygen is good for us, right? We all know that the more oxygen we have in our body, the healthier our bodies. Yes, we know we need to breathe. Yeah.
We don't do it enough,
yeah,
right?
we don't do it enough.
When you're angry, just stuck here, right? Or if you're frustrated. Watch the kids.
And ozone is actually oxygen instead of O2, two molecules. Ozone is O3, it's three molecules. And what that does is when ozone is presented to the body, whether it's in a way of where it's topical, and I can explain that, or internal, which can be ozonated water that you drink, which could be ozonating the blood, which can also be ozonating saline and having that also go in. When ozone enters the body, it sets off a chain reaction of healing and wellness. And since we all know, it's common knowledge, lots of sicknesses and diseases cannot survive in an high oxygen environment. Yeah. So that's what ozone facilitates in the simplest of forms. I had an experience with ozone, which blew my mind. And I had a bug bite. And the bug bite, it was a mosquito bite, wasn't healing the way it should. And after several weeks, I began to notice that it was more tender, more red, and everything I knew to do to help the bug bite heal wasn't working. And then it quickly began to progress, and it was pretty quick, to where it doubled in size. And I didn't want to take ozone. I didn't want to take antibiotics. And so I sought out a practitioner that provided ozone in their office. When I went in and had my consultation, I was told it was cellulitis. Yeah. And cellulitis can spread fairly quickly. And many people lose their limbs to cellulitis. It can be a very, very serious condition. So I needed to do something fast. I didn't have time to just do something mild that might work. So I decided to do an IV ozone therapy where they would draw out about 7.5 ounces of blood. They would mix it with the ozone gas and they would put it back in again. I had 3 of these treatments on 3 different occasions, and my cellulitis was 100% gone, completely healed. What I also noticed, though, were other things. I seemed to be more limber, like maybe I was a little inflamed before, and that seemed to be better. I felt more energy, more clarity of thinking, and I realized that it didn't just have an effect on the one site that I was concerned with, it had a systemic positive effect on my body. So ozone is something now that I recommend. I think it's a great adjunct to other things that people are doing. It has the ability to really improve every cell in the human body.
So a few things. So cellulitis is infection of the tissue. Cellulitis can go into the bone where you get osteomyelitis, which becomes much more dangerous. And if it goes in the blood, you have sepsis. And sepsis is when the bacteria is in your blood. So, everything we're talking about is, your experience, of course, and a lot of other practitioners, I want to capture that. none of this is medical advice. I just want to make sure this is informative advice. Ozone is not FDA approved, but there's a lot of things that are not known. And again, I have too many people saying that this is incredible for infection, this is incredible for circulation, and other conditions as well. So, so again, always talk to your doctor or alternative practitioner or functional medical doctor or naturopath or acupuncturist or people who are just doing that. So what kind of conditions do you actually, when people come in or when people that what kind of conditions do they come in and seek for? I've heard a lot about Lyme's. This was something other people have mentioned to me, because Lyme's is so difficult, it's so chronic, and it's also so controversial. People who have Lyme's, they're like, here, I do, and people don't listen. So what conditions do you actually know, common treatments that you've seen, really people improve on?
Yes. So, I want to also, before I answer that, touch upon something. Sure. Ozone might not be mainstream in the U.S., but it's been around for hundreds of years in other countries. So Germany has probably is one of the countries that has done the most research on ozone, but it's in Italy, it's in a lot of European countries, and it's not as foreign there as it is here. Okay, it's very common. In fact, in Germany, I have been told by colleagues of mine who've been there that every single practitioner's office has an ozone generator.
Wow.
So if you come in with an ear infection, or you come in with a wound, or you come in with something, they have the means of helping you using ozone. There are no side effects to ozone, so no negative side effects to ozone. It does no harm when done properly. The risk of any sort of side effect that's damaging is less than taking a Tylenol. So when ozone is administered correctly, it's very, very powerful and very, very safe. Some of the conditions, the thing I love about ozone is it doesn't matter what your condition is. So in other words, you don't have to have this diagnosis. You can have a chronic condition or an acute condition. You're not sure what it is. Ozone most likely can either greatly improve it or can potentially take care of it. But Lyme's is one of them. But Lyme's is one of those things where it's so difficult to heal from Lyme's, right? Well, when you get oxygen in your body, it goes everywhere. And hidden infections are another thing that ozone is very good at. If someone knows that they've got something going on but they don't know where, ozone is really good for that. Cancers, lots of patients use ozone for cancers. Ozone is also very good with any other therapy the person might be doing, whether it's natural or whether it's conventional medicine. It's complementary to that. It doesn't interfere, it's not contraindicated.
That's great. So again, all of these are alleged, none of these are FDA supported, so I want to just say that so that everyone doesn't run. I want you guys to do your own research, but like I said, a lot of people have mentioned this, especially in this, the time that we live in. We have to get better, faster, we got to heal, quicker, old wounds that are hard to get rid of, or acute disease, such as the viruses going around. If there's a role for this, I'm very curious. I'm getting very excited about, possibly, indulging in this, to try to help our families.
Yeah, and with a lot of the coronavirus and viruses, the talk about viruses and so on and so forth, out of Italy, there are several studies that show the effectiveness of ozone with COVID-19.
Okay, great.
Yeah.
So exciting, different alternative technologies. Thank you so much for sharing some of your experiences with regards to this. Is there anything else you want to leave our, tell us before we...
Yeah, there is. I actually, if I may.
Yes, of course.
I just want to encourage people who might be sick or might feel like they're stuck or might be on medication that they feel like they don't want to take, but they have to take it. Within the box of medicine, physicians are doing the best they can. And when my doctor told me, my gastroenterologist said there is no cure, he was right. There was no cure in the box in which he functioned in. If you are not getting your answer where you're at, look somewhere else, but never stop looking. Our bodies are amazing. They want to be healthy. You just have to find the right treatment, the right modality, and never, never, never give up.
That's amazing advice from Pamela, who's in Redlands. It's funny because again, I was treated very traditionally. First couple years out of medical school residency, that's all I could see, and it was only after listening to our patients, whether they had side effects from X procedure or medications. So many asthma, allergy, eczema. It's really through homeopathy, which was also made in Germany.
Yes.
Started in Germany. The French took over. That immediately I saw so many things that just didn't make sense. I started using it immediately, changed the way I practice, and then of course with functional medicine, you can go so much deeper into understanding the body.
Yes.
There's nutraceuticals, there's herbs, there's Chinese remedies, and amazing sort of massive amount of different practitioners. Acupuncture, yoga, meditation, breathing treatments. You were talking a little about, there was specifically your emotional.
Yes.
What was it called?
Emotion code.
Emotion code. So I got to learn a little bit more about the emotion code. That's a different conversation. But there are different people that have these unbelievable talents. Muscle therapy, I don't want to forget that. Movement therapy, breathing. That really can make a huge difference, and there's too many stories, too many miracles out there for these things to be dismissed. So whether they're anecdotal or done within a studied system, if things are not working, Pamela's advice is amazing. Just keep looking until you find, and when you do, then you're responsible for your own healthcare. And when you see something change, please share your story.
Yes.
Share your story, share it over and over again, because our system is not made really to go outside the box. It's all made to stay inside the box. And there's just too many people who have phenomenal stories, and when there are millions of them out there, it's too hard to disvalidate or put in saying this is not, right? So again, thank you so much, Pamela. Thank you for your wisdom. Thank you for what you're doing.
And Dr. Ed, I want to acknowledge you. I want to acknowledge you for being a medical doctor, being trained in the traditional medical way, and for seeing and recognizing and acknowledging that there might be another way. Because for someone with your training and your education out there, showing people that there's more to healing than traditional medicine is powerful. So I want to thank you as a medical doctor. The work you're doing is amazing. So thank you very much.
Thank
for
you.
that.
You don't need to thank me. I love it. So it's truly a joy for me. So
Good.
and once you see, you can't go back in the box.
No.
So that's the beautiful thing. Again,
Thank
thanks
you.
again. Thanks, awesome. Bye.